Absent adrenal gland, also known as adrenal agenesis or adrenal aplasia, is an extremely rare congenital condition where one or both adrenal glands are missing from birth. The adrenal glands are essential endocrine organs located on top of each kidney, responsible for producing hormones that regulate critical bodily functions such as metabolism, immune response, blood pressure, and the body's response to stress. The absence of these glands can lead to severe hormonal deficiencies, resulting in significant health challenges and, if untreated, can be life-threatening. What is the adrenal gland? The adrenal glands are small, triangular-shaped organs that play a crucial role in maintaining homeostasis in the body. Each gland consists of two main parts. 1. Adrenal cortex, the outer layer, which produces steroid hormones such as cortisol, helps regulate metabolism, blood sugar levels, and the immune response, and assists the body in responding to stress. Aldosterone regulates sodium and potassium balance, as well as blood pressure. Androgen, sex hormones that contribute to the development of male traits and reproductive activity. 2. Adrenal medulla, the inner part, which produces catecholamines like adrenaline epinephrine, increases heart rate, muscle strength, blood pressure, and sugar metabolism, especially during stress fight-or-flight response. Noradrenaline norepinephrine works alongside adrenaline to help control the body's response to stress. Causes of absent adrenal gland. The absence of the adrenal glands usually results from genetic mutations or developmental issues during fetal growth. Key causes include 1. Genetic mutations. Specific mutations in genes responsible for the development of the adrenal glands, such as mutations in the SF1 steroidogenic factor 1 gene, can prevent the proper formation of these glands. 2. Congenital adrenal hyperplasia CAR. While CAR typically results in abnormal adrenal gland development rather than complete absence, severe cases can lead to underdeveloped or absent glands. This condition is due to enzyme deficiencies that disrupt hormone production. 3. Associated syndromes. Absent adrenal gland can be part of a broader syndrome involving other congenital abnormalities, such as triple-A syndrome, Allgrove syndrome, which affects multiple organ systems, 4. Including the adrenal developmental issues. During embryonic development, the improper formation of the adrenal glands can result in their partial or complete absence. This could be due to issues with the neural crest cells, which are involved in adrenal gland development. Symptoms of absent adrenal gland. The symptoms of absent adrenal gland are due to the lack of essential hormones that the adrenal glands produce. These symptoms can vary depending on whether one or both adrenal glands are absent and the extent of hormonal deficiency. The condition often presents itself in infancy or early childhood, and the symptoms can be severe and life-threatening. Adrenal insufficiency symptoms. Fatigue and weakness. Chronic fatigue and muscle weakness are common due to the lack of cortisol, which helps regulate energy levels. Hypoglycemia, low blood sugar. Cortisol is essential for maintaining blood sugar levels, and its deficiency can lead to dangerously low blood sugar, especially in newborns and young children. Hypotension, low blood pressure. The absence of aldosterone, which helps regulate blood pressure, can lead to persistent low blood pressure, dizziness, and fainting. Electrolyte imbalance. Aldosterone regulates sodium and potassium levels in the body. Its deficiency can cause hyponatremia, low sodium, and hyperkalemia, high potassium, leading to symptoms like dehydration, nausea, and muscle cramps. Hyperpigmentation. Excess production of ACTH, adrenocorticotropic hormone, in response to low cortisol levels can lead to darkening of the skin, particularly in areas exposed to friction, such as the elbows, crisis situations, and knuckles. Adrenal crisis. In cases of severe stress, illness, or injury, the body's need for cortisol increases dramatically. Without adrenal glands, this demand cannot be met, leading to adrenal crisis, a life-threatening condition characterized by sudden severe abdominal pain, vomiting, diarrhea, low blood pressure, and shock. Developmental issues. Failure to thrive. In infants and young children, the absence of adrenal glands can lead to poor growth, weight loss, and developmental delays due to chronic malnutrition and hormonal imbalances. Diagnosis. Diagnosing absent adrenal gland typically involves a combination of clinical evaluation, imaging studies, and blood tests. Blood tests. These tests measure hormone levels, particularly cortisol, aldosterone, and ACTH. Low levels of cortisol and aldosterone coupled with high ACTH, can indicate adrenal insufficiency. Imaging studies, ultrasound, CT scan, or MRI can be used to visualize the adrenal glands. In the case of adrenal agenesis, the glands may be absent or underdeveloped. If a genetic cause is suspected, tests can identify mutations associated with the absence of adrenal glands or related syndromes. Treatment. The management of absent adrenal gland focuses on lifelong hormone replacement therapy to compensate for the missing adrenal hormones. This includes corticosteroid replacement. Daily oral hydrocortisone or other corticosteroids are used to replace cortisol. Mineralocorticoid replacement. Fludrocortisone is used to replace aldosterone and maintain proper electrolyte balance and blood pressure. Stress dose adjustments. During periods of stress, illness, or surgery, the dose of corticosteroids is increased to mimic the body's natural response to stress. Regular monitoring. Lifelong medical follow-up is essential to monitor hormone levels, adjust medication dosages, and manage any complications. Prognosis. With appropriate treatment, individuals with absent adrenal gland can lead relatively normal lives, though they must be vigilant about their condition and adhere to their treatment regimen. Without treatment, however, the condition can lead to severe complications. Conclusion is potentially life-threatening. Adrenal gland is a rare, but serious condition that requires early diagnosis and lifelong management. Understanding the importance of the adrenal glands and the critical hormones they produce is essential for managing this condition effectively. With proper medical care, individuals with this condition can manage their symptoms and lead fulfilling lives. The after effects of having an absent adrenal gland adrenal agenesis or aplasia can be significant and long-lasting due to the critical role these glands play in producing essential hormones. Without proper management, the absence of adrenal glands leads to a variety of health challenges. Here are the primary after effects. 1. Chronic adrenal insufficiency, lifelong hormone dependence. Individuals with absent adrenal glands will require lifelong hormone replacement therapy, particularly corticosteroids to replace cortisol and mineralocorticoids to replace aldosterone. This dependency means that missing doses or improperly managing the therapy can lead to serious health crises. Adrenal crisis. Even with treatment, there is a constant risk of adrenal crisis, especially during times of physical stress, illness, or injury. Adrenal crisis is a life-threatening condition characterized by severe hypotension, shock, and potentially death if not treated promptly with emergency corticosteroids. Metabolic and electrolyte imbalances. Hypoglycemia. Individuals may experience recurrent low blood sugar levels, especially in response to stress or missed meals. This can lead to symptoms like shakiness, confusion, and in severe cases, seizures or loss of consciousness. Hyponatremia and hyperkalemia. Due to aldosterone deficiency, there is a persistent risk of sodium depletion hyponatremia and potassium overload hyperkalemia. These imbalances can cause dehydration, muscle cramps, fatigue, and in severe cases, heart arrhythmias. 3. Growth and developmental issues. Failure to thrive. Children with absent adrenal glands may experience growth delays and developmental issues, particularly if the condition was not diagnosed and treated early. Proper management can mitigate these effects, but some degree of growth impairment might persist. Delayed puberty. Hormonal imbalances can also affect sexual development, potentially leading to delayed or incomplete puberty. 4. Psychological and emotional impact. Chronic stress and anxiety. Living with a lifelong condition that requires constant vigilance can lead to chronic stress and anxiety. The fear of adrenal crisis and the burden of ongoing treatment can also contribute to mental health challenges. Fatigue and low energy. Despite treatment, many individuals experience chronic fatigue and low energy levels. Conclusion. The after effects of absent adrenal gland are profound and require lifelong management to avoid severe complications. With proper medical care, including hormone replacement therapy and vigilant monitoring, individuals can lead relatively normal lives, but they must be aware of the ongoing risks and challenges associated with the condition. Early diagnosis, effective treatment, and patient education are crucial in minimizing these after effects and improving long-term outcomes.